I'm Dr. Scott Brown, and I have good news for those who suffer from obsessive compulsive disorders. I'm a board-certified chiropractic neurologist, one of less than 1,000 worldwide. We treat something in brain balancing therapeutics called hemisphericity. And obsessive compulsive disorders are part of the spectrum of autistic disorders such as Asperger's, Tourette's, PDDs, conduct defiance disorders, and so on and so forth. They're not necessarily in every autistic child, and not every OCD patient has Tourette's, but it's what's called comorbid. And in these conditions, we now know scientifically that there's a maldevelopment of areas of the brain called the cerebellum, the thalamus, the basal ganglia, and particularly the orbital frontal cortex in obsessive compulsive disorders. Now, the orbital frontal cortex is closely aligned with a primitive area of emotions called the limbic system, and in particularly an area called the amygdala. And this orbital frontal cortex and amygdala process aversive reactions that trigger compulsive behavior. And in an affected child, typically there's an increased awareness or vigilance about all the things that happen in their surroundings. There's a fear and actions that are inappropriate to the stimulus themselves. And so these children or adults will develop what's called repeating behaviors, and the big word for it is perseveration. And what this does is it helps reduce anxiety. The orbital frontal cortex is basically an error correction center, and if these individuals feel their performance isn't good enough, they will overperform in order to be perfect, which of course they never are, as none of us are perfect. And then as a part of this, there's an increase in what's called thalamic activity. Now, the thalamus is one of those areas that is involved with these obsessive compulsive disorders. And when we have increased thalamic activity, it results in hyperkinesia, which is another big word, which means that there's too much motor activity. So the obsessive compulsive children and adults have memory problems, cognitive problems, word retrieval problems, depression, apathy or mania. They can have academic problems, and guilt and shame usually will precede tics and twitches. This is not fun to live with, and there is hope. You can get on our waiting list to see me in our practice, but first I would like you to call our team and have a 5-minute phone conversation with me. Just so I'll make sure you're in the right place. Or I'll find somebody in another part of the country if you need someone who's closer to you. My website is www.browncnc.com, and I hope I can help you or your loved one with this very difficult disorder. Thank you.